Thank you for your interest in the Radiography Bridge program. The purpose of this recording is to give you a general overview on your courses in the program and for clinical. First of all, the Radiography Bridge program is 5 semesters long, with each semester 16 weeks in duration. In that 16 weeks, we break it up into 2 parts. Sequence A was 8 weeks long with 2 courses. Sequence B is 8 weeks long with 2 courses. You'll only take 2 courses together at one time. The externship and radiography review or registry review are in the last semester. Pima Medical Institute uses a learning management system called Blackboard. Blackboard is web-based, and you'll have your own secured login and password. You can review your grades at any time. The lessons are released throughout the course. There is a due date map to keep you on track, and we recommend you put those due dates in your phone so you don't lose points for late assignments. You must maintain attendance and submit work on a timely basis. No submission after 14 days past the due date will be accepted and results in termination from the program. Your lessons are a mix of textbook reading, with the textbooks are all ebooks or online, multimedia presentations, video lectures, assignments, tests, and discussions. It is important to review the due date policy once you start your classes. You can log in and do your assignments at any time of the day. Assignments and tests are due in Arizona time zone, which does not change with daylight savings. You want to make sure you check your PIMA email daily. Communication with faculty must come from a PIMA email address. Faculty will respond within 24 hours, and tutoring is available. If you'd like to have extra help with the course, you reach out to your program director for that assistance. Your faculty and program director can also communicate with you via phone call as well as Zoom meetings. For the radiography review course, you must have a computer with a webcam and microphone capabilities. Chromebooks are not valid computers for this program. The main goal of graduating from the program is taking and passing your registry exam. Please plan to take this exam seriously and spend a significant amount of time studying during the radiography review course. Take the ARRT exam immediately after graduation. Do not wait. After passing the ARRT, you'll need to apply for state license depending on your state and where you live. A clinical overview is provided for you here. The clinical rotation is scheduled in the last semester, which is semester 5 of the program. It is 7 weeks long with no exceptions. You can't try to finish early. The schedule is 36 hours a week for 7 weeks for a total of 252 hours. The daily schedule may vary slightly depending on which clinical site you're assigned to. The schedule will be prepared 2 months prior to the start date of the externship. There will be 2 groups of students, Group 1 that begins their externship at the beginning of semester 5, and then Group 2 which begins at the midterm of semester 5. We will ask for your first, second, and third choices for your clinical assignment at the beginning of the program. Please note that we cannot guarantee any of your choices. Many things happen during the time that you start the program and the time you get ready to go to clinical. We will send you an updated list of clinical sites when you're in semester 4, the semester before you go to clinical, and ask for your top 3 choices again. Chances are there are many new clinical sites that may have come on board since you started the program. So what do you need for clinicals? Well, the immunizations that will be required before you go to clinical will include the following. Hepatitis B needs to be a 3-dose or a titer if you've had the immunizations already. Then you'll need a blood titer to make sure you have the right amount of immunity levels in your system. Same with measles, mumps, and rubella, a 2-dose or a titer. Your PPD or TB must be within 12 months of your clinical start date. If the test is positive, then you'll need to provide a chest x-ray report that shows you are negative for TB. Your Tdap or tetanus, diphtheria, and pertussis is a 1-dose with a booster every 10 years. Your varicella is a 2-dose or a titer. Your seasonal flu vaccine is for the season that you'll be attending clinical. You will need your COVID vaccine plus any boosters that are recommended. There may be additional immunizations required by the site, and you'll find that out in plenty of time. So what else? You will need a background check. The one that you have at the beginning of the program, provided you've had no activity from the beginning of the program until the time you go out to clinical, is fine. You can use the same one. However, if you've had some legal charges against you, you will have to get a new background check. CPR needs to be the basic life support offered by the American Heart Association. Hospitals are very picky on which one they accept, so only get this one. You may be performing CPR at your externship on a patient. It happens all the time. Make sure your card will not expire while you're on your clinical assignment. You will be required to submit a 10-panel drug screen when you are within 30 days of starting clinicals. You may get this drug screen anywhere you wish, but you will need to provide a computerized printout of the results. You will be provided deadlines for the preclinical documentation when you're about 2 months away from clinical start. Please note that if you fail to provide any of your documentation by deadline, the hospital will cancel your externship due to noncompliance. They don't play, so make sure you have everything submitted on time. When you're at the hospital, you'll be expected to submit your weekly documents, such as your timesheet, rotation schedule, and repeat log weekly, as well as any exam evaluations you've had signed off for the week. This way, we're able to determine if you're getting an adequate volume and variety of patients at your site. There is so much to remember, and there is, so don't sweat the details just yet. We will have a separate clinical orientation when you're about 2 months away from starting your externship. The clinical orientation will be available in a series of videos, so you'll be able to watch them as many times as you wish. What does the registry require? Glad you asked. The registry requires that each student be signed off as fully competent on the following procedures. 10 patient care competencies, and these are usually your back office type skills, such as all of your vital signs. 36 mandatory imaging procedures. 15 elective imaging procedures, for a total of 61 competencies in 7 weeks. It sounds like a lot, but you can do it. What you'll want to do when you get on site is get those familiar ones signed off as quickly as possible. Now, what else will you be doing? Well, in semester 5, that last semester, in addition to clinicals, you'll also be taking Radiography 3, which is your registry review course. This will be the only class that runs while you're at clinicals. Now, travel. Depending on where you live and where you're assigned, you'll most likely have to travel. If you live in California, you'll have to travel out of state. Those are the California rules. Sorry about those that live in California. You will have to go out of state. Each student is responsible for their own housing arrangements, their own transportation, and their own uniforms. Our hospitals ask that you wear solid color scrubs, but there's a couple that may have a color preference because their departments are color coded. When you're about 30 days away, I will send you the email address of the student who is either currently or was most recently at your assigned site. I will also have information about each site in the Blackboard course for clinical. And of course, as always, I'm glad to answer any questions you may have about your clinical rotation. Each student will need to bring their own right and left markers to use at clinicals. And when you're about 30 days away from starting your clinicals, I will order and send to your mailing address your radiation dosimeter and a student photo ID. So make sure you keep your mailing address up to date. If you should move while you're in the program, make sure you update your address in the student portal. A word of caution. As you may imagine, during a pandemic environment, hospitals screening very carefully on whom they allow in the hospital. So make sure you're wearing your photo ID visibly on your person anytime you're on hospital property, and there's no problem. And consequently, if you do not have your dosimeter, you cannot be in the imaging department, nor can you participate in any imaging studies. So wear both of those items visibly on your person anytime you're on the property. So I'm sure there are many details that you have, and you have lots of questions, and we don't expect you to remember them all, especially right now. There will be reminders throughout the program, but if you have clinical questions, you're welcome to ask them during your upcoming interview. Thanks again for your interest in the Radiography Bridge program. We look forward to speaking with you soon.